Hi, and welcome to the Victress Podcast. I'm Dr. Elisa Marino, and I'm joined with Aaron Hazelbaker. Today, we're excited to have a guest, Jason King with C&A Benefits out of Dublin, Ohio. And I'll introduce him in a minute because I want you to hear his perspective from the health plan, the benefit side of things. I always tell everybody I would not have gotten into this had I known I had to learn all of this about benefits and health insurance and all of these things. I just want to help patients, just want to help them save money. Well, it turns out, having a good health plan and, understanding the insurance that we have is really important to people. And it is huge, especially as a business, for recruiting, for retention. It's competitive out there, and it's getting really hard to be competitive within the health plan. But like everything else that we're doing in our clinic, this gives the most hope to our business owners, to their employees, to our HR professionals, if they're willing to pay attention and look, and they're willing to dig and understand a little bit more and not just pass off this decision to a broker or to somebody else. Do not send this down the line. As business owners ourselves, you've got to take a look at this because it's likely the number 2 spend on your entire budget, right, is your health plan. And it's the same for our entire country. And so we want all of these dollars and cents back into your pockets as business owners. And we want you to be able to, at the end of the day, be able to give your employees a raise and amazing health care. So we're doing things on the healthcare side of things, and we brought in Jason to explain on the benefit side of things, what is this whole revolution about, that you don't just have to accept a 15%. This happened the other week. We had a company come in. They said, we got a 40% renewal in our health insurance plan, but our broker found us a 15% renewal, and they were so happy with that, and that was okay, and they were willing to take it and just move on and go with it. And so, pause. Perfect. Okay. And so they just took it. I'm like, wait a minute, let's try to get you a decrease. Let's try to get you no increase, and let's get you a 0 deductible plan and primary care. So, with that, I'm going to turn over to Jason with C&A. Thanks for being here.
Yeah, appreciate it. That was very well said. You touched on a lot of great points, and C&A Benefits, second generation family business out of Dublin. Me and my stepbrother are the second generation that is following in Christina King's footsteps, trying to continue the legacy of helping small businesses all over the state and the region. But yeah, you're exactly right. It's the only part of our businesses that we just accept failure, and that there's a really large system in play that's truly set against us for someone else's benefit, that affects all of our employees in 2 really important ways: their personal health and finances. So we have been on this journey. Really started probably 8 years ago. Our business was founded in 2009. How do we bring world-class benefits down to smaller employers, right? They're the cornerstone of our community, especially a community like this, Sydney, Ohio, right? Like everybody's husband, their own family members, your parents probably are involved. We say small businesses, say, 15 to 500 employees, right? That's pushing the definition of what small business is, but these are privately held entities that our family members work for, right? Which, just the status quo health system, and insurance companies, they make a lot of money off of that market segment. So, the example that you gave, right? We hear that every day, and it's not biased towards one industry or another. It's across the board. Traditional insurers, they don't discriminate in that way. It's truly all types of small businesses, are affected by this. So,
why don't you go ahead and paint us a picture? But by the way, I like accepting failure. Like, where else in our business do we accept failure?
Exactly.
Yeah.
That's
I'm going to use that.
And
Sure.
the easiest thing is like, any manufacturer is probably the easiest example to understand. It's like, what manufacturer just lets a supplier, if you're buying, raw goods, of some kind to make a widget to then turn around and sell it. This would essentially be just like accepting any increase from any supplier without, question.
Yeah.
And the supplier being able to tell you, oh, like, this just is what it is, like, deal with it. And I'm sure there's like some raw material suppliers in manufacturing where like that is the case, especially if it's a very limited, whatever they're buying is limited supply. But
now when it's the number 2 cost
yeah,
in your budget, like, you're going to do something about
yeah,
that.
exactly.
We got to find a different buyer. Sorry. We're going to negotiate. Like, that is not acceptable.
Exactly. Yeah. That's where, you certainly can put yourself in that manufacturer's shoes and like, they're doing that, they're, whether it's importing it or whatever, they're going to find a reason to make it important. They're going to hire somebody to manage it full time. They're going to do something to get it under control.
It just feels like, and I'm going to cut in, Jason, it just feels like, oh.
See how their mic's sitting just below?
Yeah.
Yeah.
I can level out what we've done. That's the only thing I was going to say.
Okay, cool.
So, don't want to cut in, but I feel like it just feels like it's just this like untouchable amount. We have no control over this. And I think that's where we wanted to bring you in so that you can kind of really help us to pull back the covers on this, because we're kind of being scared into this idea. You just have no control. Your cost's just going to go up every year. And it's just this up, hopefully we can make it next year because we've had another 15%. Hopefully next year's not 20, So
I was just wondering, Jason, if you could kind of paint a picture of like some of the results that you're seeing because of the plans that you're doing and the innovation. And this is like we've got to find a different solution. You guys have those solutions and this is happening across the country. What are the solutions, the results that you guys are seeing?
Yeah, I mean, you got to picture as a business owner, whatever the exact opposite of what you've been feeling for however long your business has been running. We're talking about 0 to, 3-4% increases in annual cost. Your employees paying less per pay, $0 deductibles. And then, most importantly, if direct primary care is built into a plan, you're talking about true wellness being achieved. So reversal of diseases that have been said, you were going to be married to for the rest of your life, like type 2 diabetes, people that are pre-diabetic, reversing that, high blood pressure, hypertension, these things that are finally getting under control, high cholesterol levels. Because at the end of the day, the reason that the, healthcare expense continues to go up, the traditional insurers are going to point to claims. But if there are less claims, right, we're already getting at the heart of that argument. So, I mean, true wellness is the solution to this problem. Now, we as human beings know behavior change is, very hard. It's very hard to convince somebody that's been taking a blood pressure medication for 15 years that, it is possible to reverse that. But there's lots of examples, that you guys can speak to, within Victress, I'm sure, and outside as well, because there's other direct primary care, doctors around the country that are seeing the same results, which just speaks to the intimate relationship and the actual practice of medicine, which the traditional health system borderline can get away from because of their misaligned incentives. So, I mean, it truly is so different, but it does require behavior change. And we're always very upfront about that. The more buy-in from the top down, the better, but it is controllable. It's change. And again, it's affecting two very, sensitive topics, right? Your personal health, your family's personal health, your kids' personal health, and money, right? So we all know like the state of inflation and the economy and all these things. So throw that on top of like a very sick child or, a chronic condition that has like hospitalized you multiple times over the last 10 years. Like this is stressful. And, like we're very aware of that. And, that's why we have this basically roadmap of how there's a lot of levers that you can pull. You don't have to pull all of them and go, extreme, opposite of like a traditional insurer health plan. you can do it in phases, and we encourage that. But certainly, direct primary care being at the core of a health plan, like nothing is going to control your cost more than that.
Well, and I think that's something that we really like to speak to also, because the idea is that within direct primary care, when you're talking about conventional medicine and conventional primary care, what unfortunately has happened over time is that these good primary care doctors have kind of been handcuffed in, much shorter visit times, referral, not just quotas, but like you must refer out in
Right.
order for our business model to succeed, right?
Right.
So that's where direct primary care kind of puts that on its head. Not only are we able to spend more time with the patients, but in addition, we have to refer out much less. Now, are there times when we refer? Of course, specialists are definitely needed, but the idea is that's where it's a completely different mindset, and that's where then we can help kind of keep those costs contained for folks. I think the other thing that you spoke to that I just wanted to kind of speak to too is, yes, we do talk about behavior change from a couple of perspectives. The perspective you're talking about is behavior change kind of from the employer. What we talk about is behavior change from the patients that are in front of us. Now, is that always necessary? No. There are times when that patient sitting in front of us is not quite ready for that blood pressure medicine to come away, and we're not going to pull that away from everyone. That's not the point of direct primary care. The point is to be with the patient where they are when they're ready. Now, as far as behavior change, that you're talking about top-down behavior change. So tell me a little bit more about that.
Yeah, so it's just again, it's we touched on it earlier, but it's starting to think differently. It's, hey, if I'm a financial, whether it's CFO, controller, some in a smaller business could be different roles, even down to office manager or owner. You have to start thinking about a health plan like you think about everything else. So you have to, if you want to think of the components of a health plan, right? You have to control pharmacy costs. So that's one thing. You have to control large claims, and you have to control access to good primary care. So we need, and luckily in Ohio, we have regional networks where these are privately owned PPO networks that
PPO is...
Oh, I'm sorry. Yeah, using acronyms. Preferred Provider Organization.
Sure.
We have access to these networks, which essentially means we have access to contracts, contracted pricing with health systems.
So that means like if somebody needs a specialist visit, needs an MRI, needs a, you name it,
right.
You have the ability to say, I know what this price is going to be, not having to worry about it on the back end. Oh, is it going to be $3,000 or is it going to be $300?
Yeah, very similar to how people use traditional insurer networks that we've had forever. Mm-hmm. And so you may never have, heard of these since you've worked at a company that's had one of the main players for so long. But we've done our due diligence. We've, especially in Ohio, moved groups from traditional insurers to the independent PPO networks. And, anytime that you do that, like, is it 100%, no disruption? No, but there's going to be some disruption if you go from one traditional insurer to another also.
Sure.
It's never going to be 100%. And once people get on those provider searches and start to see, okay, usually it's like the CFO or the HR person does it first, and they're before this goes any further, I'm gonna check my spouse's or my doctor or my whatever it may be, OBGYN, I'm gonna make sure that I'm okay. Mm-hmm. And once they feel that, then they can allow themselves to start thinking about all the other positives that we were talking about, right? Mm-hmm. The benefits of DPC, $0 deductibles and, out-of-pocket maxes for families. I mean, you want to make a huge financial impact on your employees' lives, family of four, we're all parents, tell them or give them a health plan where they can get better care and eliminate that expense. What does that allow you to do? Go on vacation? Because we have stories about that. People calling us crying that they're going to get to go on vacation for the first time in a year because of the plans that we built.
Yeah, we loved that. Earlier this year, we had that experience where Lisa and Jason walked in and the owner is standing up in front of them saying, hey, here's how much on average, I believe it was $4,400 on average was spent, before your deductible was met. These are your out-of-pocket costs on average. What I'm doing with you right now is I'm giving you a 0 deductible. So that's like a $4,400 per employee raise, for that particular business. And I mean, that's just almost mind blowing for these folks, $2
an hour raise if you're trying to be competitive. And that's what the studies are showing too. They're saying at least $2,000 per employee per year when you're using these innovative plans. And you guys are seeing those results. They're matching the studies that are being done across the country. The Society of Actuary has been called in to study direct primary care, study these innovative plans. Like the results are there, and it's an incredible benefit to the employees and to the team.
Yeah, and it's like we got here, and like by no means, we've been honest with you guys about it. Like we made a lot of mistakes getting to this point, but through that, we've arrived at a place where we know and trust all of the partners that we work with. We have built our own health plan, right, that we control, that are all players here in Ohio, that, we're constantly meeting quarterly. How can we make this better for, better experience for everybody, the employer, the employees, the providers. And, that wasn't just like the first thing that we did, right? We relied on other people for a lot of years. And, being transparency is like a buzzword in healthcare, right? And, we were going in a direction where we were being more transparent than the status quo, but still finding that the people we were working with were not being transparent with us. So, eventually Christina just, came to me and was like, I feel like this is what we have to do. And I was like, well, that seems complicated. But what it comes down to is like, I always tell people that I feel like what we do with working with employer groups, like it's such a relationship business. And you always think of that like in terms of your clients, right? Like, why are we successful? Because we have great relationships and clients that know us and trust us on a very personal level. But we never thought of it, or at least I didn't, in like the quote unquote our supplier side, right? Like who's supplying the function of processing claims, who's supplying the function of being the pharmacy benefit manager, and extending that same thought process and like vetting process to the supplier side, really is what has made this all come together. And like, I think so highly of all the people that are involved in the plans that we're doing. And they continue to, bring innovative ideas, hey, how can we make this better? Showing us perspectives that we wouldn't have thought of or uncovered on our own. And that's what makes it really special, is when you break away from status quo, big health insurance, you're really entering a world where it feels like you have like 5 people in your corner instead of, 5, say there's 4 or 5 functions. You have 5 people that are in your corner at all times versus the status quo, which is 0. Mm-hmm. Right?
You're on your own.
No email, no contact, no phone
you
number.
You might have your broker.
Your broker.
Yeah.
Right? And like we were talking about this before, but I think that there's a lot of brokers out there that it's simply is that they just don't understand the core issue to start with, which is we call it the marriage between big health and big health insurance. So big health meaning the mega health systems that we all know about. If you've ever given birth or had a major surgery, you probably interacted with one. And the major insurers, which we all sort of know who those 4 or 5 players are. Once you understand that intimate tie and where the revenue is coming from on both sides, you can't really understand why what we're doing works, right? And could talk about that for 3 hours, but
Yeah, maybe walk us through the realization what that was like for you, because you guys had been in traditional insurance, you'd used those big names, here I have my card, and you used those for a number of years.
Sure.
What was that transition like in
Um,
order to step away from that?
yeah, I mean, it was over a series of years, right? And it's like anytime you start to uncover a bunch of new information, right? You get it all right at first, and you think you're like, I'm an expert now, I know everything, and then you slowly learn more, and it's like, I always tell people, like, I first started thinking big insurance was the problem, and I was like the smartest person ever because I would, they're the problem, blah blah blah. Then I started learning about the realities of how the health systems operate, nonprofit health systems. And then I went, super deep down that rabbit hole and convinced that no, that's the problem. They're the problem. And then you start to learn more, and you learn just how the government has played a role on both sides of that, and how they affect the insurers and how they make money, and how they affect, obviously, setting up like the tax code so that these health systems can be not for profit. And so you have these three, it's really government plus big health insurance, and how they interact, that has created the problems that the majority of employers and employees face.
And throw big pharma in there too.
Yeah, yes, certainly. Yeah, throw big pharma's like on the side cheering them on, cheering them all on.
They're on the side buying them all up is what they're,
Yeah.
what they're doing.
Yeah, that's true.
But yeah, so you start to realize that, like, hey, these ideas that used to be available only to these mega corporations, right? Walmart, Coca-Cola, Apple, Microsoft, they're all, they have on-site clinics, if we're speaking to the direct primary care piece, right? They're self-insured. They, can give these like really, really great benefits. And then it's just started with like a group of individuals, advisors like us around the country called Health Rosetta, that were just asking, like, why can't we just copy that model on a smaller scale? Like, we all know the functions that have to exist in a health plan, right? We know someone has to process and pay claims. Somebody has to manage and source pharmacy. Somebody has to manage and source primary care. Okay, you are not, a insurer, and you're telling me you can process and pay claims. That's a third party administrator.
Yeah.
You're telling me that you can manage pharmacy. You're an independent, pharmacy benefit manager. You're a direct primary care provider. You're telling me that you can manage primary care. So it's like, okay, well, we're all independent. I'm an advisor that's, not a publicly traded company, and I'm working in my client's best interest. You can do that. You can do that. You can do that. That's 4 people, right? Back to what we said earlier. That's 4 people that are now like in your business's corner, that can align with your incentives, that want to keep you as a client for the long term. None of us have shareholders on Wall Street, because
the other part of that too is you all have transparent pricing, and that's what I think is the most important piece of that. You know exactly how much it's going to cost for this person, and this person, period.
Right. You're not just getting a rate from a big insurer that's like, where is that, $900 for employee only coverage that I pay when the insurer bills me? Like, where's that going? Like, you're right. You're never going to get that.
And then speaking to your side of it too, right? So you guys being the other end of that, we know exactly how much your cost is, so any employer that joins in, here is the C&A benefit cost. Now, I ask our employers a lot, do you know how much you're paying your broker? They don't really. And that's one of the things that's a little touchy-feely. Can you speak to that a little bit?
For sure. Yeah. I'm glad you brought that up, because it is, I don't want to say by design, that way, but that feels too aggressive, and I don't want to, come off that way. But yeah, we, in the spirit of transparency and working in our client's best interest, we want to bill them directly, just like they bill their customers, right? Like, again, everything else we do in business. So yeah, we tell people straight up what our fee is. The traditional model, if we're working with a big insurer, we're going to get compensated by them. There has been legislation passed where that has to be disclosed to the group. So brokers or consultants can be at fault if they're not doing that part. That's changed since the CAA in 2021.
Only if they're asked to, like
No, you have to regardless. Yeah.
Okay.
So yeah, you have to disclose any compensation that you're receiving for benefits, basically, to your clients. So is everybody following that? I don't know. We do it because I do all of those every month. So I know that we do it and we follow the rules about disclosure. But it's kind of funny when I send our groups that are on, our plan or these creative plans, like when I send them that, I always joke, I'm like, hey, here's the compliant form that the government said I have to send you. But like, you already know this because we're actually transparent with you about what we're making. Like we tell you day one, right? It's not like a surprise, like waiting to get that form. And then, oh my gosh, like I didn't know they were making, whatever it is, from the insurer. So again, in the spirit of transparency, you're going to know what everybody within the health plan, all 4 or 5 of those parties are making, what the cost is,
And it's just so, this again is just so amazing. Like when you actually piece it apart like that, then your number 2 cost becomes something that you do have control over when you look at it from that perspective.
Absolutely.
So I think that that's so important, is like not just that like out there, oh, I'm wishing that it would go down. You don't wish any other part of your business goes down in cost or up in revenue. We have a plan for each of those things. Now we have a plan for the number 2 cost in your business.
Yep, absolutely. And it's, we always tell people it's a word Christina uses a lot. It's a really good word, is unbundling, right? All these functions.
Absolutely.
4 or 5 functions, right? Claims processing, network, pharmacy benefit manager, direct primary care, consultant, all of these exist in a traditional setting. The issue is when one entity owns all of those. That's when you really, that's the most eye-opening thing, is when, you have a traditional card and you see like the pharmacy piece, and then you look up the name of that company and you realize that it's owned by the same people that own the insurance company. And it's like, okay, well, it's all my insurance, so it makes sense that they're both owned.
Yeah.
But like what that means for them is the unbelievable ability to print money, especially on the pharmacy side.
Yeah. So this is something we like to talk about too. So explain that a little bit more. Like, what does that actually mean for the employer, much less the employee?
Yeah. So what it means for the employee is that next year, that 40% increase that you referenced at the very beginning, when that gets delivered, it's going to be delivered with a message that your claims were so high. And it's like, well, what claims? Well, your pharmacy claims. Well, why were your pharmacy claims high? Oh, it turns out that when the claims were filed, you guys just marked them up to some arbitrary, you took a $4 metformin and made it $104, right? And then charged our health plan $104 for a medication that you could pay $4 cash for. So our pharmacy claims are high because you made them high, through this mirage of business units and, pharmacy benefit manager and the insurance company being owned by the same publicly traded entity.
And that's why you're seeing Cost Plus Drugs, right? Mark Cuban, you're seeing GoodRx, you're seeing all of these, ways to circumvent that and say, hey, even if we only make 15%, we're doing better than your insurance plan.
Yeah.
And bring it back to the cash price. And
it's pretty cool. This problem is getting out there. Like what has been going on, like Dave Yost in Ohio has gone after some of the larger pharmacy benefit managers. You can
Is he the Attorney General? Is
that
who Dave Yost is?
Yes, he's the Attorney General, yes.
Yeah.
You can use the Google machine and look it up for yourself on how knowledgeable he is on this and, what happened to the state of Ohio's, Medicaid program. But if it's happening there is a 100% chance it is happening to you.
Pretty sure it was $100 million. And 2 of the biggest names in health insurance.
Yep.
And that was even in their Medicaid program.
Yeah.
That they're recovering this money from pharmacy, that they're marking up the prices and then charging it back to Medicaid.
Yeah. So if it's a
So
tax,
those are tax funded dollars.
I was going to say, if as a taxpayer, that doesn't, make you fired up as a tax paying business owner, like, I don't know what would.
Yeah.
But yeah, the system is set up so that on the insurance side, they can make 15% profit. On the pharmacy side, they can make as much money as they want.
Which is why they all have then chosen to own the pharmacy side of it as well. And I
Yep.
think that's the part that, is so awesome about being able to carve these pieces out, like what you're talking about. So I guess just to kind of like recap a little bit, the idea is that we take the plan, and this is what not us, but Jason's doing, what Christina's doing, C&A Benefits doing, and they kind of carve out pieces of your plan. So you've got this, insurance plan. Your employees see 0 deductible as long as they're a member of direct primary care. So that's one component of it.
Yep.
The other,
Potentially a local.
or yes, exactly, or a local primary care that is a trusted source, depending on the area that you live in. The other side of it then is carving out this pharmacy benefit so that it's not owned by one of those big name insurance companies. Because when you carve that piece out and it's independent pharmacy, then what we're able to do is know the exact cost of those drugs that are being marked up exorbitantly for you currently.
Yeah.
And then the other piece is then that
Hospital
contracts and, that all those claims. That's
Third-
what you were calling
yeah.
it. Like
Right.
that's
Third
like
party administrator. Yep.
Right.
Yep.
Mhm.
Yeah, at the end of the day, like, you have to pay less for claims, right? So even the pharmacy benefit managers that we use, that are independent, that's what they specialize in. They align with, employer groups directly. They don't have shareholders. Like, they're in business to make money.
Sure.
We want them to make money.
Sure.
But the difference is going to be, you're going to know, right? You brought up Mark Cuban, in that same vein, it's like, you're going to know the cost per fill for drug, right? $5 to $7 every time a prescription is filled. That's what your
Sure.
health plan pays, and that's it. Where, you fill a drug, with a traditional pharmacy benefit manager, you as the patient, you're paying a copay. If you're less than, especially 100 employees in this state, it's very, very, very difficult, if possible at all, to understand the true cost of that prescription being filled, because they're going to do everything they can to hide the true cost of what the employer's plan is paying. So the cost is not just the copay that you pay the pharmacy, is like the biggest takeaway from that piece, right? There is costs that they're internally charging your employer's health plan every time you fill a single prescription.
That's right.
Tying that back to DPC, now all of a sudden you start to see where, hey, that $5 drug for hypertension, right, that you all are now managing, and you're managing that hypertension now, hey, you're in a range where, you can take half as much. So you have half as many prescriptions as you used to have, right? If it's filled once a month, I mean, that could be, on the back end, $1,200 a year that your employer's health plan is not paying. Now, I mean, you guys probably know the statistics about maintenance drugs and how common they are and how many prescriptions per person. But very quickly, if you guys can eliminate one hypertension medication, and that saves $1,200 on one person for one generic drug, one person in the group, law of large numbers, take that out over 100 employees. I mean, we're talking hundreds of thousands of dollars in claims just gone, like right away. Not to mention the fact that they're coming to direct primary care to be managed, eliminating visits to big health systems, right? So it's like a snowball that starts going downhill. And, not to even mention if we're talking about someone coming in with a sprained ankle, and you treat it doing physical therapy in the direct primary care setting, and there's an MRI that gets avoided, right? There's all those visits to an outsourced, more expensive physical therapy clinic or specialist follow-up visits that are just completely unnecessary, because they're back doing what they back to work, or back to whatever activities they were missing out on. So
Plus, if you overpaid for the year in your claims, you could potentially get that money back.
yeah, that's
Too.
it. That's, yes, very true. So
You get to keep your money.
yeah, in the plans that we build, we build them that way so that if there's a surplus, meaning, back to incentives, right? Like all of these players that make up this unbundled health plan, they want to keep these, all of us, the third party administrator, the pharmacy benefit manager, DPC, we all want to keep this client for the long term. So, we're all incentivized to control cost, right? Because the lower the claims are and the lower amount you pay for those claims, the more likely that you're going to have, we call it a surplus, in your claims fund at the end of the year. And that money is yours. It's an asset to your business. We typically tell people to leave it in there because even in our plans, stuff's going to happen. Someone's going to get cancer. There's going to be a heart attack. Like, this is just being human beings.
But you don't have to be scared of that, right? I mean,
Right.
I think that's the thing right now that we hear so stinking often is that fear. Well, what if, and it's like, yeah, great. We've got a plan for that. We've got a contingency for that too.
Right, for sure. And that money it's yours, it's your business's. It's not just being taken for profit and paid out to, shareholders of these companies that are traded on Wall Street. And I was actually talking to Avery, telling her that I was coming here, and she was asking me, or we were just got into kind of like this conversation about this topic. And it's like talking to financial professionals, CFOs, controllers, COOs, other business owners. It's like, you guys all are investors. Like, we're talking about a population
Absolutely.
of people that
Yeah.
hold stock, right? You're holding stock more than likely in some of these companies, and the returns that you're personally getting are at the expense of your own business. I mean, think about that. And like, when you put it in that, frame of mind, it's like, wow, like, if this company can be, part of the S&P 500, and I'm buying shares of, a stock that owns, like a exchange traded fund that owns the entire market, I literally am getting dividends or returns from shares at the expense of my business.
Sure.
And that just, like, a CFO that knows anything about anything, like, that's going to just like bamboozle their mind right away. Like, so that it really is that simple.
Mm-hmm.
And I think that's when, like, I start to get like frustrated, I guess, is when
We understand.
yeah, trying to not use aggressive language. When I get frustrated is when it's like you're trying to look for an out. You're trying to look for, like, oh, there's some other thing at play here. And it's like, there's government controls on the insurance side. There's no controls on the pharmacy side. They're exploiting you. It is what it is. And you can either play that game, it's rigged against you, or you can do something different.
Yeah. Yeah.
And that's what is killing our schools. It's killing our municipalities. It's killing our communities, our taxpayers. Like, we are all losing because of it. But there's an option, and the options are really good. And they're really, really good. And so what sort of backlash do you hear? What are the confusions when you talk to CFOs, to business owners, to HR professionals of why they wouldn't change?
I think that, so the question, if the benefits of this are so good, like, if this all sounds too good to be true, why?
Oh yeah, that's a great way of phrasing it.
Yeah, and I mean, it's a situation where we're talking about something where everybody's had a bad experience with probably both sides of it, the big health system side and the big insurance side. Everybody, has got a bill from a provider that they weren't expecting, right? A surprise bill. Everybody has dealt with an insurer not paying something that they were supposed to pay, or not paying what they expected them to pay on their behalf. So everybody has these negative experiences, and I think that just sets the tone for the overall skepticism that exists when making any changes related to this.
Well, especially because they've also been told then, oh, this is your, this is your only option, or, this is all we can do, or, the idea of like, well, we can get you maybe a little lower price. And it's like this whole negotiation thing,
Right.
rather than like, this is something completely different. There's
Yeah.
no more like, oh, let's, shave a couple percentage points off your increase,
Yeah, it's very true. You're literally talking about like two different games.
Yeah.
You're talking about game A, which we all know. If it's with one of those 5 companies, the game is rigged against you. We're playing a game with different rules, where the rules are in favor of the group. And it's really that different. It's so different you almost can't compare it. But when we say different, like that can be scary, right? And so people, when we're meeting with them, we're saying that it's different, but that's good to your patients, or your guys' patients, members, right? Your, as a business owner, the employees. We're putting in privately owned networks where if they don't want change, they've had the same relationship with X pediatrician for a number of years, like we're not taking that away. Like, we are Americans, we like the freedom of choice.
Absolutely.
So like that, is something to hang on to when we're talking about this, is like, I have no doubt in my mind that, with Victress at the center of a plan, that word of mouth is going to work, and it's going to, the people that are hesitant at first because they're, going to keep their pediatrician or OBGYN or this or that or the other, no matter what. Once they start to hear the coworkers, like the younger people that don't have those deep relationships, come here and have the first experience, it's not even a fear of mine, like as a consultant, that it's going to work, right? It will work. Some groups it will take longer than others, and depending on how the plan is designed and some other factors, but it's never really a question. It's just a matter of time. But yeah, we're not trying to, tell you who your doctors are going to be. Like, that's not what's happening here. We're not trying to tell you how, you take care of your chronic illnesses. What we're trying to do is, show you that there is a better way. You're going to take home more money in your paycheck. And next year, we're not going to have to come to you in that open enrollment meeting and sit down and say, hey, last year your biweekly deductions, Lisa, were, $80, and now they're going to $110. So, sorry, you just took whatever that, 60-ish dollars times 12, like you just took a pay cut, right?
Yeah.
Without taking a top line pay cut, you took a pay cut. So I think I might have got off topic there, but I don't remember what your initial question was.
Just what the holdup is with change.
Yeah, I think another really big one is my broker would have told me this. Like, if this was true,
why didn't my broker tell me about
why didn't my broker tell me this?
Because I really trust my broker.
Or why can't we do just this one piece of this, is another big one. And, I think I mentioned it earlier, but I think on the broker side, it's just, it is more work. So if brokers have heard about it, on our end, right? Because we're managing 5 relationships instead of 1. So it's more time. It's harder to build a business in what we do doing plans like this than it is just taking big insurance plans off the shelf and plugging them in wherever. So that's one thing. So if a broker hears about it, they're like, I've been doing this 30 years. That seems like so much time, energy, and effort. Like, I'm about to retire, and I'm going to stick with these carriers that have, paid for my boat at Lake Erie, and like, we're good. So that's one thing. The other is they just haven't been, opposite of that, they just haven't been exposed to it, right? So if you're, going into this industry, what we do, and you haven't, been, Christina says, you brought it up earlier, raised by insurers, right? Raised how to sell their product, raised in the industry how to make them money. Those people are typically more receptive to and it's a generational thing too, like just call it out. Like it's, I think that the younger generation is more apt to question the status quo, and it's just kind of fits in what we've all experienced over the last couple of years, like whether it's government institutions or through COVID, like what is true, what is reality, who's being transparent, right? That's just kind of like the world we're living in now. So I'm hopeful that there are other younger people in the business like myself and my stepbrother that will continue to hear about Victress, hear about these type of plans that we're doing. We do not come from a famine mentality, because there's so many companies out there. Like, I would love for somebody to figure out what we're doing and build the equivalent.
Mm-hmm.
Like, all that's going to do is have more people talking about doing things differently, which is what's going to solve the problem.
Well, I love that. And I think the other question with that we get very often is, well, how come my broker doesn't think it's a good idea to add on direct primary care? Can you speak to that a little bit? Because I think that is something that we're talking about all the time. So from our end, we see the actuary, all of this information that's coming out saying that even just having direct primary care is going to reduce your costs. And we can see that. We can see why through specialist visits and extra testing that maybe doesn't necessarily need to be done, reducing prescription costs. And again, this is nationwide data. It's not just me spouting off what's happening right here in Sydney, Ohio. We have the same results, but it's nationwide data. So why would a broker say, you know what, it's not really going to be too advantageous for you to add direct primary care? Is there a reason?
Well, if their compensation is tied to it, would be a sort of like an elephant in the room reason, I would say. But
I mean, like they get a percentage of the claims, or
if they're working off a percentage of premium and they look at any data about DPC lowering the cost of care, which lowers claims, is going to lower what the insurer can justifiably increase them to the following year. So I mean, that would be one. Another thing, I think it would just go back to them, their lack of understanding and feeling like they're going to take on more work. And if there's
Sure.
issues, their phone's going to ring on the weekends and at night when people are, trying to remember who to call, what's Victress's
Sure.
number. They told
Yeah.
me to call. I don't know the number. Now I'm having a problem. Now the broker's phone is ringing, right?
Mm-hmm.
So, I mean, those would be the two that I think of like right off the top of my head.
Sure.
But what other, from your guys' perspective, do you?
No, I think that's really important, because I think that's part of it is the third option would be that they just don't know, right? And they
Yeah.
just don't understand. It's like, well, it's primary care. I mean, what's the big whoop, because so few people have had such great experience in primary care, right? So I was really lucky, and I know we've shared this story before, but my 2-year-old at the time started having seizures, and I was just at a loss of what we could do to help him. And I was referred, I'm like, who can I go to for primary care that will, work with me, sit with me? And a good girlfriend of mine said, well, my doctor switched and she does this weird thing now and they don't accept insurance. I'm like, sweet, because we only had like a Christian health sharing plan. Okay, great. Let's go to this doctor and figure this out. And that experience was mind blowing. She sits there with you for 60 minutes, just like we do here at Victress, then follow ups for 30 minutes. Then she's on the phone with my son's neurologist, asking the questions and being that go between for us. She's doing all the things outside that primary care used to do. And I was blown away by that. But how many Americans, how many people in Sydney, Ohio, how many people in Shelby County have had that experience with primary care to even understand that that's possible?
Right.
Very, very few. Unless you're a patient of ours, it's pretty unlikely. You're probably used to the status quo. And so that's sometimes some of the pushback that we get from brokers, like, well, what the heck could primary care even do?
Yeah, and I think it's easy. I have to like check myself because we're sitting in this room and there's pictures of sports all around the wall, and all of us come from like this background of college sports, professional sports, and it's like we have a probably a bias and a subconscious like understanding of like the control that you can have
Mm-hmm.
and the discipline that you can have, right? That through training, exercise, you know, really taking care of your body, right? Like that's the core of like preventing anything that ends up walking into the front door in the first place. So, you know, us as former athletes, I mean, I have to check myself. Like if I had not lived that life and, you know, I had been told from the time I was in my early 20s that I was pre-diabetic and that morphed into type 2 diabetes, and I've been giving myself insulin for however many years, like what my worldview almost would be about these things and how hard or scary. You know, it's easy to sit here and be like, I've never had a chronic health condition and, you know, everybody should be like me. Like that's just really naive and not the reality. But the fact is that a lot of these things are controllable. A lot of them are, right? Are there genetic things that randomly happen? Yes. Like my mom died when she was 44, colon cancer. That's not supposed to happen. Bad luck, right? She was fit, ate a good diet, you know, just bad stuff is going to happen in this world. But the amount of control that you have is just, you know, no big health system is ever going to have that conversation with you.
Oh, we couldn't agree more. And I think that's part of what like we jump in on all the time is like the idea that when you're ready, we're here for you, right? So it might not be the first 2 visits, might not even be the first year, but if we can build that relationship with you so you can understand that when you're ready, hey, things have calmed down a little bit. I'm ready to start talking about this. Great, let's do it.
Yeah.
And kind of understanding that you have options. We lay that out for people up front. And that's what our nurse practitioners do so well. It's like, hey, here's your options. You know, your cholesterol's been creeping up for a while. What's that? What's going on? Like we've got some inflammation somewhere here. That doesn't mean I'm going to throw you on a cholesterol pill. What that does mean though is that I kind of want to dig a little bit. Are you ready for that? Okay, you're not ready for that. No problem. Hey, let's try this supplement. Are you okay with starting with a supplement? And kind of like walking through that. Does that make sense? So when somebody then is ready to like, man, my stress has been through the roof and I can't take it anymore. I am ready. You know, okay, great. Let's have this conversation. But it's not always that way. And especially when people come in expecting a normal primary care visit, sometimes it does take them a while. They're kind of like, oh, you know, I wasn't expecting that. Yeah. So, so I totally agree. And I know that that's what direct primary care is doing around. I know that's what their focus is. You know, it kind of depends. Did they shift to doing supplements? Did they shift to having more of those, you know, diet-based discussions all the time? Is it exercise? You know, it's different whichever direct primary care you're looking at. But really the idea is that if somebody's ready, we're here for them. Not everybody's ready. They've been told since they were 20 years old, this is your fate.
Yeah,
you
exactly.
know? And so I think that's a big part of it.
Well, and what, you know, one of our nurse practitioners always says is, you know, she's catching something 70% of the time that the patient didn't know about. Did you know you have nodule on your thyroid? Did you know, that you're in kidney failure? Did you know? And it's like, those are the things that should have been caught that are the scaries.
Yeah.
You know, to a lot of business owners is like, no, get them in. We need to know these things so that you're not having these issues down the road. So that can be managed as well. But walk us through the process of what it looks like. You've met with a company, you've talking to a business owner, you starting to educate them on these things of like, hey, and I know you guys are really good about this of we just want to educate. We want you to know, we want to empower you with this knowledge. What does that process then look like for a company to change?
Yeah, so I mean, most transitions do happen, at the time of renewal. Again, I think that's like in the thought process, like this is that thing we hate. It's always bad, so we only think about it once a year.
Yeah,
right. So that's
I won't name anything.
that's kind of why it typically happens, like when a traditional plan is coming up for renewal. It doesn't have to. It's obviously to the benefit of that game and that system to feel like it has to happen then, but the truth is it doesn't. Now, I can't say 100% of the time. There's nothing 100% in the world that I live in, but most of the time it can happen mid-year. Now, from my experience, somebody has to really either get what I'm saying very quickly to fight the 30 years of pain of dealing with this issue, like again, say it's halfway through the year. They just went through their least favorite thing that they do as a COO or CFO or HR VP of HR, CHRO. And now you're asking them to do it again in the middle of the year where it's probably like the time of year they focus on something completely different and have been for 25 years. So they have to really get it. And if they really get it, they will see that it's imminent and they need to act now. Otherwise, we will get a shot the next time that renewal comes up.
Yeah.
So, and what that means is, yeah, you're right. It's about education. It's all we're showing you is facts. If you want to like deny what's in front of you, that's to your, for you to decide if you're going to do that. But it's not like we're sitting here, making things up or saying that relationships exist that don't. We'll use the Google machine. We'll give you lots of things that you can Google to fact check what we're telling you. And
Well, I think too, one of the things that you really hit on too is just the fear is just so pervasive because it feels like this is a scary thing every year when this comes up. It's scary. It's like, oh my gosh, brokers coming in. What are we going to be hit with? That's scary. Change is scary because it's like, okay, well, how can we go away from these? Everybody knows these big name companies, these big name health insurance. We can name them off, but we don't even need to. Everybody knows the name of them. How could we possibly go away from them and still be safe? And so that's what we talk about too, is like we have certain employers that are like, listen, we are innovative. I see a place where I can save a lot of money. I am in, and they will jump in, with 2 feet. And then other folks that are, and rightly so, right? If you own a business with 200, 300, 500 employees, and even if you're smaller, it's still, the thought of that can be a little bit scary. Can you speak to that a little bit about how you can kind of calm those fears a little bit?
I would say, the scarier thing is outsourcing your fate to somebody on Wall Street that doesn't care about you or know where Sydney, Ohio is. I mean, that is more scary to me. Especially once you have social proof, which we do have lots of social proof of groups that, would stand on quite literally, I think a few of them stand on the street corner out here and shout from the rooftops that, this is the solution. Everybody, we're innovators. We're getting there quickly, eventually. It's gonna have to go that way. So might as well be a first mover and have that advantage, like you said, in your recruiting and your retention of your employee base. Right? It's like weaponize your HR department in a good way. Give them like the most incredible health plan imaginable, and all of a sudden your business grows in all these other ways that aren't even directly real. We've been talking a lot about money, but it's like meaning premium savings and how much employees pay out of their paychecks, but it's like all these ancillary ways that this impacts your business. Like you just recruited the best engineer, the best foreman, the best plumber that you could because of a health plan now.
Zero deductible. I feel like we can't say that enough because I can't even tell, as a healthcare employee, for years, my entire time being a healthcare employee, I had to have a high deductible plan. The option was either high deductible or higher deductible plan.
Yeah.
There was no like,
We're talking like 10 or 12,000.
right, exactly. Yeah. We were talking like 12 grand, for my family. And
So
now we're talking about zero deductible.
If you're working for a health system and like they can't even figure out how to give their employees like a $0 deductible,
right.
Like that tells you just literally that's almost the same equivalent, just obvious writing on the wall as the CFO that's invested in some of these companies through like an exchange traded fund. It's so just blatantly obvious. That should tell you everything that you need to know.
Yeah. Sure.
About how they do business and the issues that can exist. So
We literally had a family member that was told you would be better off to go on the marketplace. Like, go shop out for
insane.
Obamacare because we cannot even find any better rates than you. So
Yeah.
we're working on that.
Yeah.
But thank you so much, Jason, for explaining the background, for explaining why you do what you do, and just thank you for being willing to put yourself out there. We know it's not easy. We know it takes 5 times more work, but it's, man, you guys are small business owners. We're small business owners. This is the heart of America. We've got to do something different. You've got to do something different. It's our communities, it's our kids. And we really want you to get the money back that you should. And we're excited. We're passionate about helping the patients get healthier. And then we're so pleased that we have options through C&A Benefits to build a health plan that will give you safety and security, and that can help you sleep at night. So thank you so much, Jason.
Absolutely. Yeah, this was fun.
Good. Okay.
Appreciate you giving me the voice, and love doing stuff like this. So hopefully do a couple more times and get some more good info out there. I think we could deep dive into a lot of these areas, and but this is a good overview. We touched on a lot, and I think more to come after definitely would sort of fill the gaps on some of the things we touched on. So appreciate it very much.
All right. Thanks.